support to these candidates, they also help to address the staffing needs of UK healthcare providers. MentorWise Magnate Ltd is a UK-based company primarily focused on supporting individuals in the healthcare sector, particularly those looking to work in the UK. Their services and courses are centered around three main pillars: training, recruitment, and immigration. They offer a variety of training programs to help individuals gain the necessary certifications and skills for healthcare roles. This includes both online and face-to-face instruction. The company provides staffing solutions for healthcare clients by recruiting qualified professionals. They specialize in placing a range of workers, including registered nurses, doctors, healthcare assistants, and other allied healthcare professionals. They recruit both within the UK and internationally. The company has a dedicated immigration team to assist their clients and recruited candidates with personal and business immigration matters, making the process of moving to the UK for work smoother. MentorWise Magnate Ltd offers a comprehensive range of courses, with a strong emphasis on preparing international nurses for UK registration. These include IELTS, International English Language Test, and OET, Occupational English Test. These courses are designed to help candidates achieve the required English language proficiency for UK healthcare registration. CBT, Computer-Based Test. This training prepares individuals for the multiple-choice computer-based exam, which is the first part of the Nursing and Midwifery Council (NMC) test of competence. OSCE, Objective Structured Clinical Examination. They offer a combined online and face-to-face program for the final, practical exam required for NMC registration. They provide training for different nursing specialties, including adult and mental health nursing. MentorWise Magnate Ltd provides a diverse range of educational courses. They offer accredited training in essential areas like health and social care and health and safety. The company also partners with educational providers to deliver diplomas in business and IT, helping students gain qualifications in these fields. MentorWise Magnate Ltd was founded by Moises and Wendell Marcelino, who have extensive combined experience in both the healthcare and recruitment sectors. Having personally gone through the relocation process in the UK, they have a deep understanding of the challenges and importance of immigration support. Their mission is to assist overseas healthcare professionals, including nurses, midwives, and other allied workers, with the complexities of registering and relocating to the UK. By providing comprehensive, or holistic, support to these candidates, they also help to address the staffing needs of UK healthcare providers. MentorWise Magnate Ltd is a UK-based company primarily focused on supporting individuals in the healthcare sector, particularly those looking to work in the UK. Their services and courses are centered around three main pillars: training, recruitment, and immigration. They offer a variety of training programs to help individuals gain the necessary certifications and skills for healthcare roles. This includes both online and face-to-face instruction. The company provides staffing solutions for healthcare clients by recruiting qualified professionals. They specialize in placing a range of workers, including registered nurses, doctors, healthcare assistants, and other allied healthcare professionals. They recruit both within the UK and internationally. The company has a dedicated immigration team to assist their clients and recruited candidates with personal and business immigration matters, making the process of moving to the UK for work smoother. MentorWise Magnate Ltd offers a comprehensive range of courses, with a strong emphasis on preparing international nurses for UK registration. These include IELTS, International English Language Test, and OET, Occupational English Test. These courses are designed to help candidates achieve the required English language proficiency for UK healthcare registration. CBT, Computer-Based Test. This training prepares individuals for the multiple-choice computer-based exam, which is the first part of the Nursing and Midwifery Council (NMC) test of competence. OSCE, Objective Structured Clinical Examination. They offer a combined online and face-to-face program for the final, practical exam required for NMC registration. They provide training for different nursing specialties, including adult and mental health nursing. MentorWise Magnate Ltd provides a diverse range of educational courses. They offer accredited training in essential areas like health and social care and health and safety. The company also partners with educational providers to deliver diplomas in business and IT, helping students gain qualifications in these fields.
All right. Welcome everybody. Today we're gonna have our topic for today is thyroid, and today we have a speaker, Dr. Saksham. Um, so yeah, at any point you can click the raise hand in Teams if you have any questions. So yeah, let's start the webinar. Dr. Saksham, the floor is yours.
Hello. Thank you for the introduction. I'm Sakcham Kadel, and today I'll be presenting on thyroid disorder. Before I start my presentation, I'd like to thank everybody who took their time to write the feedback for my last presentation. I really appreciate it, and I hope you will do the same for this presentation as well. So, without any delay, let's start the presentation. Just give me a minute. Okay. I hope, yeah, is the slide visible to everybody?
Mm-hmm.
Okay, let's start. Okay, today I'll be talking about thyroid disorder, and by the thyroid disorder, I will be talking mainly about hypo and hyperthyroidism. And there is another spectrum of thyroid disorder, which is obviously cancer and masses, and that I will not be discussing about that in today's slide because that is a huge topic and that would be a discussion for another day. So let's start by knowing what thyroid gland is, where it is, and how does it functions. So thyroid gland, it obviously lies in front of our neck, and it is wrapped around our windpipe like a butterfly, and then it have two lobes which is joined by the isthmus. So when you look at the picture, that is a right lobe, left lobe, and behind it is a trachea, and it is just behind below below the larynx, which is our voice box. And then this is where thyroid is present in our body. And so let's talk about the functions of thyroid. Thyroid primarily secretes three hormones. They are T3, T4, and calcitonin. And by the when we say thyroid hormone, we mainly mean T3 and T4 because that is the main secretion. But it also does secrete calcitonin in a minor amount, and the calcitonin hormone, it is responsible for the calcium metabolism, and T3 and T4, they are the main hormones that is secreted by our thyroid gland, and they are the hormone that controls the metabolism. So another thing that we need to understand is thyroid obviously secretes T3 and T4, but the majority of the hormones secreted by thyroid gland is in T4 form, but T3 is the form that is more active. And so what happens is T4 form is converted to the T3 form before it goes to the effector organs like skin, gut, kidney, and everything everywhere. So the T3 is the main more active hormone, but the T4 is the main hormone secreted by our thyroid gland, and it will and T4 form is converted to the T3 form when it gets to the effector organ. So now let's talk about what T3 and T4 hormone does in our body. The basic thing T3 and T4 hormone does it, they increase the metabolic rate. So by increasing the metabolic rate, they increase the oxygen consumption in our body, and it also lead to the production of heat. and it has also effect on carbohydrate metabolism as well. So what it does in carbohydrate metabolism is it increases the amount of glucose in our blood by increasing the glucose absorption and increasing the synthesis of glucose inside our body. So, talking about the fat metabolism, effect of thyroid hormone on fat metabolism, it helps to break down the fat by increasing the lipolysis process. So, when you talk about the protein metabolism, it increases the level of it increases the protein synthesis in our body, which obviously help in growth and repair. So, so thyroid hormone, other thing that we need to remember about thyroid hormone is it helps in brain maturation in child and infant. So if the child does not have enough amount of thyroid hormone while they are growing, it can lead to some developmental problem as well. And the other thing it does, it increases the heart rate and cardiac output, and yeah, it also help in bone growth as well. And yes, that's about it. So, what it does when it take the function of thyroid hormone as a whole, what it does, it increases the energy production and which help in growth and development, and it is essential for normal brain development as well. Okay, so when we keep this function of thyroid hormone in our mind, it will be easier for us to understand the symptoms of hypo and hyperthyroidism. So I'll be talking about the symptoms in coming slides, but first let's talk about how the production of thyroid hormone is regulated. There are three main organs responsible for the regulation of thyroid hormone production. The first one is hypothalamus, and second one is pituitary gland, and the third one is thyroid gland itself. So, thyroid hypothalamus, it secretes a hormone, a substance called TRH, which is thyrotropin releasing hormone. And so the TRS, what it does, it stimulates the pituitary to secrete the TSH, and TSH, it stimulates the thyroid gland to produce the thyroid hormone T3 and T4. And when the level of T3 and T4 it rises in our blood level, it gives the negative feedback to the pituitary gland as well as hypothalamus, so that the secretion of this TRH and TSH is controlled. So this is in this way the thyroid hormone production is regulated. So there are three organs and three hormones which regulate the synthesis of T3 and T4. And once the level of T3 and T4 increases in the blood, it sends signals to hypothalamus as well as pituitary, and the T3 and T4 hormone production of this T3 and T4 hormone is down regulated. So, in case of thyroid disorder, this normal physiological regulation of the production is disturbed. Okay. So now let's talk about some of the symptoms of hypo and hyperthyroidism. So as I told you earlier, when we have function, when we know the functions of thyroid hormone in our body, then it will be easier for us to understand the symptoms of hypo and hyperthyroidism. So what thyroid hormone does is it increases the metabolic rate. It causes the heat production, break down the fat, and it also causes the increase in glucose production. So what happens in hypothyroidism is we become tired, fatigue, and there is weight gain because there is less breakdown of fat, and then we'll have cold intolerance, and then we'll have dry skin, slow heart rate, puffy face, swelling, slow reflexes as well, and constipation as well. So so these are the symptoms of hypothyroidism, and opposite of this happen in hyperthyroidism. So when there is increase in amount of thyroid hormone in our body, what we have is we have anxiety, we become restless, there is weight loss because there is more breakdown of the fat, and there will be heat intolerance, we'll have sweating, increased heart rate, there will be tremors in hand, and there will be some bulging in eye as well, and we will have diarrhea as well. I will talk about what will happen in eye if there is thyroid disorder in coming slides. But if there is hyperthyroidism, there are some muscles, there is some overgrowth of muscles in our eye, and it will lead to the eye problem as well. Okay, so okay, now let's talk about there are few group of people who are at risk of developing hypo or hyperthyroidism. We will talk about that in this slide. So for the hypothyroidism, old females, especially greater than 60 years of old, they are at risk. And obviously, family history of thyroid disease, it put people in at risk of developing hypothyroidism. And one of the most important thing we have to remember is autoimmune disorder. If you have any other autoimmune disorder, that will put you at risk of developing hypothyroidism. And pregnant women, they are obviously at risk of developing hypothyroidism because there is increased demand of thyroid hormone during pregnancy. And obviously, history of neck surgery also will put you at risk of developing hypothyroidism. And there are certain medication like lithium, imidazole, that will put you at risk of hypothyroidism. So lithium, it is a drug that is used while treating bipolar disorder, and imidazole, it is a drug that is used to treat some of the heart problem. So when you are taking medication like this, that will put you at risk of developing hypothyroidism. And the other thing is iodine deficiency. Iodine deficiency, it is one of the most common cause of hypothyroidism in developing old. And that if you are deficient in iodine, that will obviously put you at risk of developing hypothyroidism, because iodine is required to produce T3 and T4. So that will obviously put it at risk. And sometimes excessive iodine content intake will also put you at risk of developing hypothyroidism. Okay, S- so these are the risks that will put you at risk of hypothyroidism. So for the hyperthyroidism, there are obviously, if you are at young age 20 to 40, females, especially 20 to 40, they are at risk of developing hyperthyroidism. And if there is family history, that will put you at risk of developing hyperthyroidism. And smokers, they are also at risk of developing hyperthyroidism. And obviously, when there is high iodine intake, and if you have other autoimmune disorder as well, that will put you at risk of hyperthyroidism. So obviously, when you have some stressful life event as well, that might put you at risk of hyperthyroidism as well. Okay. So moving on to the next slide, let's talk about some of the causes of hypo and hyperthyroidism. Before I talk about the causes of hypo and hyperthyroidism, what we have to understand is there are two main causes. One is primary cause, and uh, another one is secondary cause. Primary cause is when there is problem within the thyroid gland that lead to the overproduction or underproduction of the thyroid hormone T3 and T4. And secondary cause is when the cause is outside the thyroid gland. That might be in hypothalamus or pituitary gland as well, or any other organ of the body. So primary cause is when there is problem within the thyroid, and secondary causes are when there is problem outside the thyroid gland. So for the hyperthyroidism, primary cause would be iron deficiency, as I have mentioned earlier. That is most common cause in developing country. And another one is Hashimoto thyroiditis, which is obviously the autoimmune destruction of the thyroid cells, and it is the most common cause in a developed country. And obviously, when there is thyroid surgery, and when there is when we use radioactive iodine for the treatment of hyperthyroidism, it can lead to the hypothyroidism as well. So thyroid surgery and radioactive thyroid iodine, it is the treatment for hyperthyroidism, but the treatment for hyperthyroidism can sometimes lead to hypothyroidism as well. Obviously, there is congenital hypothyroidism when you have deficiency of thyroid hormone at birth. Okay, and when you talk about the secondary cause, so the most secondary cause is obviously the cause outside the thyroid gland. So when there is failure of pituitary gland and hypothalamus, they are the secondary cause, and it can lead to the hypothyroidism. Obviously, when there is failure from pituitary gland to produce TSH hormone, thyroid gland will not be stimulated, and it can lead to the hypothyroidism. And same with the hypothalamus as well, when it cannot produce TRH hormone. Okay, now let's talk about the causes of hyperthyroidism. So, primary cause of hyperthyroidism would include Graves' disease, which is obviously the overproduction of the hormone, and toxic adenoma would be when there is a mass, when there is a single mass in the thyroid gland, which produce the thyroid hormone. And toxic multinodular goiter would be goiter. When you hear the term goiter, it usually mean the growth of the thyroid gland. And when you have multiple nodules that produces the thyroid hormone in the thyroid gland, that is what toxic multinodular goiter is. I'm not sure whether I'm making sense or not, but toxic or adenoma means when there is single mass that produces thyroid hormone within the thyroid gland, and toxic multinodular goiter would mean there are multiple masses which produce the thyroid hormone within the thyroid gland. Okay, and secondary cause, obviously they are the cause outside the thyroid gland. And when you have some tumors that produces either TSH or thyroid hormone outside the thyroid gland, they would also lead to the hyperthyroidism. Okay, okay. Now, let's talk about how to diagnose hypo and hyperthyroidism. Obviously, with any other disease, with any disease, the diagnosis start from is taking the history from the patient. So, what we have to take in the history is we have to take the history about the symptoms of hypo and hyperthyroidism, and then we have to talk about the family history. Obviously, the family history of hypo or hyperthyroidism would put anyone at risk of developing hypo and hyperthyroidism. Then we have to ask about the risk factor that we have discussed earlier. And in women uh, with both hypo and hyperthyroidism, there will be some irregularities in their menstrual cycle. So we need to ask about that as well. And in addition, in women, we have to ask about whether they are pregnant or not, because the treatment would differ based on that. So in pregnancy, there would be increased demand of thyroid hormone, so we have to treat accordingly. Okay, so in the physical examination, we have to talk about we have to take the vital sign. Is with thyroid hormone, there will be some disbalance in uh, heart rate as well as respiratory rate. We have to take those vitals as well. Obviously, there will be some changes in blood pressure as well, so we have to have a look on those vital signs. And we have to examine the eyes, as I have told you mentioned earlier, that there will be some overgrowth of the muscles, mainly in hyperthyroidism, which will lead to some disturbance in eyes as well. There will be exophthalmos, and there will be diplopia as well. So we have to examine the eye to look for those signs. Then obviously we have to uh, examine the thyroid gland as well. Okay, So then we have to investigate the patient. The main major investigation would be measuring the level of TSH and thyroid hormone, which will help to determine whether the cause is primary or secondary. Then obviously, if we suspect the mass, then we have to go for imaging and biopsy as well. Okay, now let's have a look on how to interpret the result of TSS and T3 and T4 to find out whether the cause for hypo or hyperthyroidism is primary or secondary. So the first test, when we suspect the patient have thyroid disorder, we first test we do is TSS. So if the TSS is high, then we suspect that patient might be suffering from hypothyroidism. So if the TSS is high and we do T3 and T4 and T3 and T4 is low, then the cause would be primary. The hypothyroidism would be primary. But if TSH is high and T3 and T4 are normal, then we will suspect subclinical hypothyroidism. Okay, so obviously, and then when TSS, then again TS, if the TSS value is low, we have to suspect the patient is suffering from hyperthyroidism. And if TSS is low, and when you do T3 and T4, and if they are high, then it would be primary hyperthyroidism. And then if TSS is low and T3 and T4 are normal, then the cause of hyperthyroidism might be secondary. In this slide, one thing you have to remember is if the patient have some tumor in the body which secretes TSH, okay, then the TSH would be high, and be it might be a little bit confusing as well. So you have to remember that as well. So if the TSS is high, it is obviously go to the hypothyroidism. It will go to the hypothyroidism side. But if there is tumor somewhere in the body, TSS can be high and T3 and T4 also can be high in that scenario, and that would fall in hyperthyroidism side as well. So we have to look out for that as well. But that is a rare scenario when we have tumor. But in most of the cases, if TSS is high, then we have to suspect that the person might be suffering from hypothyroidism. But if TSS is low, we have to suspect the patient is suffering from hyperthyroidism. So, and then we have to do T3 and T4 to find out whether the cause is primary or secondary, and that will help to differentiate the cause. Okay. Now let's go to the treatment of hypothyroidism. So there are few things we have to consider before starting the treatment of hypothyroidism. We have to consider the age and whether the patient is suffering from coronary artery disease or not. If the patient do not have any of those, we start at a little bit higher dose. Obviously, levothyroxine is the drug that we use to treat hypothyroidism. So we if the patient is less than if the patient do not have these factors, if the patient is less than 60 years of age, and if the patient does not have any coronary artery disease, then we start levothyroxine at 1.6 mcg per kg per day. Okay, but if the patient have any one of those, then we have to go for the duration. We have to look out for the duration of hypothyroidism. If the duration is not known, we start at 25 to 50 mcg of levothyroxine. But if the duration is less than 2 months, we start with 1.2 mcg per kg per day. Okay, and once you start the dose, we have to regularly monitor the patient. So we measure the TSH in 4 to 6 weeks, and then we will continue our treatment based on the value of the TSH after that. Okay, so the only thing that we have to remember here is the patient is older and have some cardiovascular disease. We have to start the patient on a little bit lower dose of the levothyroxine, and if they do not have any of those, we will start at little bit higher dose. All right. Okay, and subclinical hypothyroidism, it can be a diagnosis, and in many cases there many patient actually the patient population with subclinical hypothyroidism is very massive in practice. So there are some guideline on how to deal with that. So treatment of subclinical hypothyroidism would depend on value of TSH, presence of symptoms, and age. Okay, so if the patient, we have to obviously when we suspect the patient have thyroid disorder, when we suspect the patient with thyroid disorder, first thing we check is TSS, and if the TSS value is greater than 10, we start the treatment for that patient. But if the value ranges from 7 to 9, 9.9, we have to look at the patient age, and if the patient is less than 65 to 75, 70 years of age, we will start patient on T4. But if the patient is older than 65 to 70 years of age, we will look at the symptoms. And if the patient has symptoms of hypothyroidism, we will start with the T4, otherwise not. But if the value is less than that, we obviously again consider the patient age and symptoms to decide whether we start treatment or not. So a subclinical hypothyroidism would be when the TSH is high. TSH is high, but the value of T3 and T4, they are normal. So that is the situation. That is the situation when the patient is having subclinical hypothyroidism, and there is a massive group of population who have subclinical hypothyroidism, and we have to follow this table while while treating those group of patient. So we have to consider age, symptoms, and the value of TSS for that. Okay. Now moving on to the next slide. On that, this is a slide taken from the National Institute for Health and Care Excellence, nice guideline. So here I'll be discussing about how to treat the patient with hyperthyroidism. So there are three main treatment for the patient with hyperthyroidism. Obviously, when you look at the hyperthyroidism, when you consider the cause of hyperthyroidism, it is usually the overgrowth of thyroid gland. There would be overgrowth of thyroid gland in most of the cases of hyperthyroidism. So we have to treat according to that. Okay, so there are three main treatment. One would be a drug, anti-thyroid drug like carbimazole, methimazole. That would be one treatment, and the other treatment would be radioactive iodine and surgery. So firstly, firstly, the treatment option would be decided by the endocrinologist for the hyperthyroidism. The endocrinologist will evaluate the patient and discuss with the patient, and they will decide on the treatment option. So and they will offer the patient three treatment option, and then decide accordingly. Okay, so for the radioactive iodine, we generally it is offered to the patient with Graves and toxic multiple nodules or toxic single nodules as an alternative to the surgery. Okay, and for the antithyroid drug, it is offered to the patient with Graves or for the toxic or single multiple nodules as well, and then surgery is offered to the Graves patient and toxic multiple nodules patient as well, or the patient having single nodules. as well. So, in this flow chart, what we have to remember is there are three treatment options for the patient with hyperthyroidism, and it is offered to the patient by the endocrinologist, and the decision would be made. And decision would be made. Then, what we have to do is we have to monitor the TSS level at regular interval. Okay, until the TSS value is normal, and once the TSS value is normal, we have to monitor the TSS value in an annual basis. Okay. So there will be continuous monitoring of TSS value for the patient with hyperthyroidism, because this treatment it can lead to hypothyroidism as well. So we have to keep in mind about that side effect as well. So it is a continuous process. Okay. Now, let's talk about the patient education. What we need to educate patient who have thyroid disorder, or is suspected patient as well. So, for first and foremost thing would be educating the patient about taking regular medication is prescription, because obviously thyroid hormone, maintaining the thyroid hormone at a particular level in the blood is very important, because they control the metabolism, and it can have, not taking the medication would have serious effect. So we need to educate patient that you need to take the medication regularly as prescribed as well. And we should advise patient not to stop the medication without the advice of a doctor, because it can lead to serious side effect as well. And the other important thing is to monitor the TSS level at regular interval. Obviously, with the thyroid disorder, you may not need to take the medication for your whole life. And that would be determined only by the TSS level. So we need to monitor the TSS level at a regular interval as well. And obviously, if someone have hyperthyroidism, one of the side effect of the treatment would be hypothyroidism as well. So the monitoring of TSS level is very important, and we need to educate patient on importance of that as well. And uh, and if the patient is taking levothyroxine, there are many drugs that interfere with levothyroxine. So we need to educate the patient about that as well, because patient might take the another medication that interact with levothyroxine, and in that case we need to increase the dose of levothyroxine. So we have to educate make patient aware that there are some drug which might interact with the drug that you are taking. So they would take advice, doctor's advice, before taking the another medication. Okay. So these all of this information can be given through leaflet pamphlets, and we can guide patient on how to find the correct information online as well. So in the next slide, I will be talking about some of the drugs that interfere with levothyroxine. So these are the drugs uh, that can interact with levothyroxine. One of the most common drug would be antacids, because antacid they can be given over the counter as well. So we need to make patient aware that this antacid can interact with levothyroxine. And the calcium supplement as well. Most of the patient might be taking calcium supplement as well, iron supplement, and magnesium supplement as well. These are the most common drug that are used, and that interfere with levothyroxine. But the other drug, they are not commonly used, but they are just for the information purpose. But these are the drugs that are commonly used and that interact with levothyroxine. Okay, so that's all for today. If you have any questions, so feel free to ask. Okay, I'll give 1 minute to ask the question. Okay, it is. Yes.
Hello,
Yeah.
hello, doctor. What is the difference between goiter and hypothyroidism?
Okay. Goiter actually, what goiter is in simple terms is it is the overgrowth of the thyroid gland. Okay. In if there is any overgrowth, that is a simple term that is used for the overgrowth of the thyroid gland. And goiter actually can cause hypo or hyperthyroidism both. Okay. So hypothyroidism, it is a condition when there is decreased production of thyroid hormone like T3 and T4, and goiter is when there is overgrowth of the thyroid gland. Okay, so goiter, it can cause both hypo or hyperthyroidism. Okay, I hope I have I've answered your question.
Yes, doctor. Thank you.
Hello, my
Uh,
name is Esther. I would like to ask, what do you have to say about a patient that was diagnosed as having thyroid? So it's not, she's not having um hypo or hyper. They just said from the results it's thyroid,
Mm.
and same times also having what's that again? Goiter. So what do you have? What's the relationship now between the hypo and hyperthyroidism for a patient that is diagnosed as having thyroid? Thank you.
Okay. Okay, so you mean that if the patient has overgrowth and but the hormone levels are normal, right?
Yeah, said this thyroid that is normal.
Okay, okay. In that case, what we have to do is we have to do the imaging. We have to do the ultrasound, and there would be one of the radioiodine uptake test. There are some tests. If I am not wrong, there is a test called radioiodine uptake test as well. That would be done, and the management would be decided based on those results. We have to see whether we have to see the character of the mass. If the mass is disturbing the other structure, because thyroid, it lies in enclosed space and it has relation with other structures as well. If it is affecting those other structure as well, uh, we have to do the surgery. But if it is not doing any harm, we might leave it and monitor it continuously as well. But the decision would be we will decide only after the investigation. We have to do ultrasound, biopsy, radioiodine uptake test as well, and then the decision would be made.
All right, thank you.
okay, I think that's. Are there any more questions? If you have any questions, you can click the raise your hand, and you would be able to open your mic. Mm. Okay, I think that's it. Thank you very much, Doctor. Um, it was a very insightful talk about thyroid uh, disorders. Next up, we're gonna move into the next part of our webinar. We're gonna have some um, advertisements on the services and the products that we are offering at MWM. So, Mark and Johnry, the floor is yours.
Hello. Thank you, Sir Churchill, and thank you very much, Dr. Saksham. Next up, we are going to talk a little bit about the services and ongoing promos that MentorWise Magnet is currently offering. OSCE trainings. The Objective Structured Clinical Examination, or OSCE, is a crucial component of the UK registration process for the Nursing and Midwifery Council, or NMC. Part 2 of the test of competence comprises a practical examination during which you will be evaluated on your clinical and communication skills. MWM offers three types of training every Tuesday from 20:30 to 22, and 5 days OSCE, and then 10 days OSCE. For more details, you can visit our website to see our OSCE passers below. Um, there is more. Future bundles. Um, future trainer, future manager, future bundle 3, future assessors, future bundle 4, future trainer and manager, future bundle 5, future internal quality assurance, future bundle 6, future trainer and learning and development, future bundle 7, CQC, registered manager interview coaching, and future bundle 8, future manager and CQC registered manager interview coaching and training, and future bundle 9, future trainer manager and CQC registered manager interview coaching and training, and the last is future bundle 10, future trainer plus business foundation. Next up, I will be handing over the presentation to John Ree for the next part of the webinar, wherein we will talk about the qualifications offered by MentorWise Magnet.
Okay, thank you, Sir Mark. The next slide will be discuss the insights regarding the individuals behind MentorWise Magnet. It was founded by Moises and Wendell Marcelino with over 20 years of combined experience in public and private healthcare and more than a decade in recruitment and training. Having relocate across the UK themselves, they understand the vital role of immigration support in success transitions. Driven by own journey, they are committed to helping overseas healthcare professional nurses, midwives, and allied workers navigate the complexities of registration and relocation. Their mission is to provide holistic support to candidates while meeting the staffing needs of the UK healthcare providers. Next slide, please. And next is NCCC Education Level 3 qualification. Level 3 International Foundation Diploma for Higher Education Studies. This qualify is what is a 1 year pre-university bridging program designed to prepare students with the essential skills to provide direct entry into undergraduate first year degree at in an international recognized university. Level 3 Business Suite Certificate Diploma Extended Diploma. This qualification suits allow candidates to demonstrate key transferable study skills, mathematical competency, and applied cultural understanding, particularly in the context of international business, as well as grounding in the essential concepts of business and economics. Level 3 Diploma in Computing. This qualification provides learners with a comprehensive introduction to computing and introduce the field of computing of equips students to show key transferable study skills, mathematical competency, and understanding of essential concepts of IT and particular computing skills. And now, Sir Mark will take us through the last part of the presentation.
Okay, thank you, John Ray. And we have also Sari Sari Shop if you want snacks or local product in different country. Sari Sari Shop explore our wide variety of items from spices that enhance your home cooked meals to treat and snack that bring you back home with every bite. Browse our shop for a wide variety of international products and flavors. And that's all. Thank you.
All right. Ma'am Wendell, or do you have a closing remark?
Thank you very much once again, Docky. I call him Docky all the time, Dr. Taksham. And also, Esther, thank you very much for showing up and joining us in this webinar, and Nikani. And to Emma, I don't know her surname, but thank you very much for joining with us. I know you are busy, but I hope that this presentation has given you some insights in terms of thyroid disorder. Thank you once again and looking forward for the next webinar, Doc. Thank you.
Okay, so I would like to also thank Dr. Saksham for sharing his expertise and insights. He has enlightened the risk of or the causes of hypo and hyperthyroidism, and lifestyle awareness in preventing complications and promoting better health outcomes. And as we wrap up, let us carry forward the knowledge we've gained today and apply it not only in our personal lives but also in guiding others towards better health practices. And finally, we are pleased to inform you that all attendees will receive a free certificate of participation as a token of appreciation for joining us in this important session. And thank you once again, Dr. Saksham, and to all of you for your time and active participation.
Okay, so for the finale, we're just gonna um, ask for those who are in here, if it's possible, you can, if it's possible, you can open your camera so we can have our documentation. We're gonna have a selfie for documentations for those who have attended our webinar. Also, I just want to say that we are going to be hosting this webinars regularly. We have a whole lot of topics lined up for in the coming months. So stay tuned to the on our social media websites of MentorWise Magnet. Um, your emails, we're gonna be sending emails as well for upcoming webinars. So yeah, stay tuned. We're gonna have more topics lined up for you, more interesting topics. So yeah, I guess everybody's ready. So yeah, so let's take a picture. So 1, 2, 3, say cheese, cheese, and okay, all right. That's great. Thank you very much, everyone, for those who have attended. And yeah, thank you. See you again next time. Thank you, and bye bye.